Dr. Cottini, I'm wondering if you could briefly go over CAR T-cell therapy and bispecific antibodies.
Yes, of course. So these are all our new therapeutic approaches for patients. And these are like type of treatment that are given to patients that already went through their induction, they were in remission, maybe had a bone marrow transplant. And then after a couple of years or months, unfortunately, the disease came back and they need new and different treatment options. So these two strategies, CAR T and the bispecific antibodies, really rely on the T cells, on the immune cells of the patient. And they all focus and target specific markers that are on the plasma cells, but they work a little bit differently. So the biospecific antibodies, and we have different antibodies that are some approved by FDA, some others are just in clinical trials. They practically recognize something that is on the plasma cells, on the myeloma cells, that can be BCMA, GPRS560, or other targets. But so at the same time, they are able to kind of get close by T cells and immune cells. And in this way, practically there is both the activity of the antibodies and also the immune cells that is kind of activating and getting rid of the cancer cells. So these are infusion. Often they're done initially in the hospital and then kind of like in the outpatient setting. This is something that is given kind of like every week or every other week or so. CAR T is a different strategies, and it's a very smart way of trying to get rid of the cancer cells. So practically these are T cells, so these are immune cells from the patient. And they are practically taken and then brought to like a very specific and clean facilities when these T cells are modified in order to be able to recognize the cancer cells. And then these cancer cells are sent back to us, and then practically they are given into the veins to the patient. And then there is this kind of like reaction of these T cells that are very happy and aggressive to kind of like being able to kill all the remaining cancer cells. So these are all the new strategies. Obviously, we are kind of like in the early process, but these are very promising therapies. I think will be maybe hopefully move up front a little bit, or like even a diagnosis in the next 10, 20 years, we don't know.